Zika had most of the world worried last year after its outbreak in Brazil, as well as confirmed cases in America.
This dreaded virus has been in the news again recently, with new information coming out about 3 confirmed cases in India in the state of Gujarat.
The 3 cases are from the months of January and November 2016, and the last one was confirmed in a pregnant woman in January this year.
So today, Doctors on Call will revisit the Zika infection. I am Dr. Sonia Lal Gupta.
And I am Dr. Sameer Gupta, and welcome to Doctors on Call. The Zika infection is caused by the Zika virus that is spread by the bite of an Aedes mosquito. This is the same mosquito that spreads dengue and chikungunya. There have also been cases of Zika that have spread through sexual contact. The infection itself is mild, with only 20% of people presenting with symptoms. Symptoms include fever, joint pain, skin rash, headache, and malaise. Symptoms are usually mild and last for 2 to 7 days. The biggest concern of Zika is its association with microcephaly, a rare neurodevelopmental condition that causes an abnormally small skull with an underdeveloped brain. For example, if the average normal circumference of the skull of a newborn baby is 36 centimeters, a baby with microcephaly could have a skull size of 20 centimeters. Pregnant women who got infected with Zika in the first trimester were found to have an increased incidence of children born with microcephaly.
Microcephaly can lead to delays in speech, vision, seizures, and mental retardation. This can be very stressful for the child and family, as very few children can lead normal lives. So how can we diagnose the Zika infection? We spoke to Dr. Arjun Dang, consultant histopathologist, to know more.
The best way to diagnose Zika depends on the duration of symptoms since the patient presented. If the patient presents in the first 2 weeks, the method that we use is a very sensitive and specific molecular method that is called real-time PCR, that is polymerase chain reaction. This method detects the virus's nucleic acids in the blood or the urine, although blood is the preferred sample. After 2 weeks, we test the patient's blood for antibodies that are produced against this virus. These are the class of IgM antibodies, and we use the test that is called capture ELISA. But it is very important to note that this test that we perform, ELISA, is not as specific as the PCR method, so it must be confirmed before a conclusive diagnosis is reached. This disease, when a pregnant mother is affected, can lead to lifelong handicap for the unborn child. It can lead to congenital malformations. The most common of these is called microcephaly. Microcephaly is a reduction in the size of the head of the newborn. So the method that we just mentioned, we can test with the same methodologies. Apart from this, we can test the unborn child by doing serial ultrasounds and also doing amniocentesis by testing the amniotic fluid. Apart from this, the cord blood that is seen at the time of birth can also be tested. Very importantly, the CDC, that is Center for Disease Control, has also laid down very specific guidelines which say that any pregnant woman who's traveled to any place where Zika is prevalent must get tested regardless of the fact if they have symptoms or not.
Now, apart from microcephaly, the Zika virus can also cause a neurological illness called the Guillain-Barré syndrome. This is a rare condition where the immune cells of the body damage the nerve cells, causing muscle weakness and paralysis, even affecting the lung muscle in severe cases.
Zika virus disease is usually mild and requires no specific treatment. People sick with the Zika virus should get plenty of rest, drink enough fluids, and treat pain and fever with common medicines.
The WHO recommends that the best way to prevent Zika is to avoid being bitten by the mosquitoes and practice safe sex.
Now that's a great point, because prevention is always better, Research is currently underway for the first Zika vaccine, but it is at least 2 to 3 years away.
We will continue bringing the latest updates on Zika as and when they happen. See you next week.